Imagine walking into a state-of-the-art modern hospital with a severe infected wound. You would naturally expect the highly trained surgeons to immediately treat you with the most advanced chemical antibiotics and expensive synthetic bandages created in sterile laboratories. We have been completely conditioned to believe that modern pharmaceutical science is the absolute pinnacle of human medical achievement. Therefore, we look back at ancient civilizations and assume their doctors were simply primitive butchers who relied on useless superstitions and dangerous, unhygienic practices to treat horrific battlefield injuries. But if you were a wounded soldier in the ancient Roman Empire, your doctor would treat your bleeding flesh with something that sounds like an absolute joke to a modern patient. They would literally pack your open wound with thick, sweet, sticky honey. To an average person living today, pouring a sugary dessert directly into an open bleeding gash sounds like a terrifying recipe for a massive bacterial infection and guaranteed death. Therefore, for the last 100 years, modern doctors completely laughed at this ancient remedy, dismissing it as a ridiculous medieval myth. But the entire modern medical establishment has recently been forced to swallow their pride and admit a shocking truth. The ancient Roman physicians were absolutely right all along, and modern science is now desperately bringing this 2,000-year-old ancient super medicine back into the most advanced operating rooms on the planet. The ancient Romans did not simply use this golden liquid as a desperate last resort when they ran out of other options. It was actually the absolute foundation of their trauma care. Famous and highly respected Roman physicians like Celsus and Pliny the Elder wrote incredibly detailed medical textbooks explicitly outlining how to clean and heal severe flesh wounds. They systematically prescribed highly complex medical salves and advanced healing poultices that relied completely on raw honey as the primary active ingredient. Therefore, a Roman battlefield surgeon treating a gladiator or a legionnaire would confidently pack severe sword slashes and deep puncture wounds with this thick golden syrup. They did not understand the microscopic concept of bacteria or modern germ theory, but they observed with their own eyes that wounds treated with this sweet substance miraculously stopped rotting and healed significantly faster than wounds left alone. Therefore, this ancient medical protocol became the absolute standard of care across the entire Mediterranean world for centuries. But when the 20th century arrived, humanity discovered chemical antibiotics and suddenly believed we had conquered nature itself. The arrogant modern medical community rapidly threw the ancient Roman texts into the garbage, viewing them as useless, outdated history. They completely abandoned the golden liquid in favor of synthetic laboratory drugs, assuming they had permanently outsmarted the brutal forces of biological decay. It took several decades of modern scientific arrogance before microbiologists finally decided to put this ancient Roman remedy under high-powered electron microscopes. What they discovered completely shocked the pharmaceutical industry and proved that the Romans were unknowingly wielding a highly advanced biological weapon. The scientists found that this thick liquid possesses an incredibly low water activity level, creating a devastating osmotic effect. When you apply it to a bleeding injury, it literally acts like a microscopic vacuum cleaner, rapidly sucking the water straight out of any dangerous bacterial cells until they completely shrivel up and die. Furthermore, the substance has a naturally acidic pH level that creates a highly hostile chemical environment where deadly pathogens simply cannot survive or multiply. Therefore, the golden syrup forms an impenetrable chemical shield over the damaged flesh. But the most terrifying and brilliant mechanism is something the Romans never could have imagined. When this sweet liquid mixes with the natural salty fluids leaking from a human wound, it triggers a powerful enzymatic reaction. It continuously generates tiny, controlled doses of pure hydrogen peroxide, constantly chemically burning the microscopic bacteria without damaging the fragile human tissue. Therefore, the ancient doctors were essentially using a slow-release chemical bomb to sterilize flesh wounds, centuries before anyone even knew what a chemical formula was. For a long time, Modern doctors simply did not care about these incredible biological mechanics because chemical antibiotics were cheap and incredibly effective. Therefore, nobody wanted to bother with sticky natural syrups when a simple synthetic pill could eliminate an infection overnight. But fast forward to the early 2000s, and the global medical community suddenly faced an absolute, terrifying nightmare. The heavy overuse of synthetic drugs accidentally created massive mutated superbugs that were completely resistant to every single modern antibiotic we possessed. Patients with severe chronic flesh wounds and diabetic ulcers were losing their limbs to unstoppable infections because the modern laboratory drugs simply stopped working. Therefore, hospitals began to panic as they realized their most advanced medical weapons were becoming entirely useless against these microscopic monsters. But in a desperate attempt to save lives, scientists finally swallowed their pride and looked back at the ancient Roman trauma textbooks. They realized that bacteria can easily mutate to survive synthetic chemical drugs, but they physically cannot mutate to survive the brutal osmotic pressure and acidic burns of the ancient remedy. Therefore, modern surgical clinics began conducting massive, rigorous clinical trials to see if the ancient knowledge could defeat the modern superbugs. The results were so overwhelmingly positive that the entire medical establishment was completely forced to change their strict treatment guidelines. By the time the 2010s arrived, this 2,000-year-old Roman medical secret officially made a triumphant and highly regulated return to mainstream global medicine. But you cannot simply walk into a local grocery store and pour cheap, processed breakfast syrup onto a bleeding injury. Modern surgeons exclusively utilize highly specialized medical-grade variations like Manuka, which are strictly sterilized, to completely eliminate any dangerous biological spores. These modern medical companies now manufacture incredibly sophisticated sterile surgical bandages, completely saturated with the exact same active biological compounds that the ancient Romans used on the battlefield. Therefore, if you walk into an advanced wound care clinic today, you will see highly trained nurses applying these specialized golden bandages to severe burns and chronic infections that absolutely refuse to heal. It is a deeply humbling reality for modern science to accept. We spent billions of dollars and completely revolutionized human chemistry, only to eventually realize that nature had already perfected the ultimate trauma medicine millions of years ago. But the most incredible part of this entire story is the massive vindication of those ancient Roman doctors. They were widely mocked as primitive, uneducated historical figures for generations. Therefore, the next time you see this simple, sweet substance, remember that you are looking at a legendary ancient medicine that outsmarted modern science and is currently saving limbs and lives in advanced hospitals right now.